Want to pass your PN Fundamentals exam? Then let's get started. Today we'll cover 10 questions on wound care. Question 1. A practical nurse is preparing to irrigate a patient's wound. Which solution is most appropriate for wound irrigation? Betadine solution, hydrogen peroxide solution, normal saline solution, alcohol solution? Pause the video and select your answer. If you chose option C, you are correct. Normal saline solution. Normal saline solution is isotonic and gentle on tissues, making it the most appropriate choice for wound irrigation, as it helps cleanse the wound without damaging healthy tissue. Question 2. A practical nurse is caring for a patient with a surgical wound. Which nursing action is most appropriate to promote wound healing? Apply a warm, moist compress to the wound. Keep the wound uncovered to promote air circulation. Use clean technique when changing dressings. Apply antibiotic ointment liberally to the wound. Pause the video and select your answer. If you chose option A, you are correct. Apply a warm, moist compress to the wound. Applying a warm, moist compress can promote circulation and comfort, aiding in wound healing. Question 3. The practical nurse is assessing a patient's surgical wound and notes the presence of serosanguinous drainage. What action should the nurse take? Apply a dry, sterile dressing to the wound. Increase the frequency of wound irrigation. Document the findings and continue to monitor the wound. Notify the healthcare provider and obtain a wound culture. Pause the video and select your answer. If you chose option C, you are correct. Document the findings and continue to monitor the wound. Serosanguinous drainage is a common type of wound exudate and may occur during the normal healing process. Documenting the findings and continuing to monitor the wound are appropriate actions. Question 4. The practical nurse is caring for a patient with a wound that is healing by secondary intention. What characterizes healing by secondary intention? Rapid formation of granulation tissue, minimal scar formation, contraction of wound edges, prolonged healing process with extensive tissue regeneration. Pause the video and select your answer. If you chose option D, you are correct. Prolonged healing process with extensive tissue regeneration. Healing by secondary intention involves a prolonged healing process with the formation of granulation tissue, wound contraction, and eventual scar formation. Question 5. The practical nurse is assessing a patient's wound and notes the presence of undermining. How should the nurse document this finding? Depth of the wound, width of the wound, presence of tunneling, presence of granulation tissue. Pause the video and select your answer. If you chose option C, you are correct. Presence of tunneling. Undermining refers to tissue destruction underlying intact skin along the wound margins, creating a pocket or tunnel. Documenting the presence of tunneling accurately describes this finding. Question 6. A practical nurse is preparing to change a patient's wound dressing. Which technique should the nurse use for the dressing changes? Sterile technique, clean technique, aseptic technique, modified sterile technique. Pause the video and select your answer. If you chose option B, you are correct. Clean technique. For practical nurses, clean technique is often appropriate for dressing changes unless the patient is at high risk for infection. Question 7. The practical nurse is caring for a patient with a wound that is healing by primary intention. What characterizes healing by primary intention? Prolonged healing process with extensive scar formation, formation of granulation tissue, contraction of wound edges, minimal tissue loss, and small scar formation. Pause the video and select your answer. If you chose option D, you are correct. minimal tissue loss, and small scar formation. Healing by primary intention involves minimal tissue loss, precise wound approximation, and small scar formation. Question 8. The practical nurse is assessing a patient's wound and notes the presence of excessive wound drainage. What action should the nurse take? Increase the frequency of dressing changes, apply a thicker layer of wound dressing, document the findings and continue to monitor the wound, assess for signs of infection, and notify the healthcare provider. Pause the video and select your answer. If you chose option D, you are correct. Assess for signs of infection and notify the healthcare provider. Excessive wound drainage can indicate infection or other complications, so it is important to assess for signs of infection and notify the healthcare provider for further evaluation and treatment. Question 9. The practical nurse is teaching a patient about wound care at home. Which instruction should the nurse include regarding wound dressing changes? Change the dressing daily. Apply antibiotic ointment liberally to the wound. Use clean rather than sterile technique for dressing changes. Keep the wound completely uncovered between dressing changes. Pause the video and select your answer. If you chose option A, you are correct. Change the dressing daily. Changing the dressing daily helps maintain a clean wound environment and monitor for signs of infection or other complications. Question 10. The practical nurse is caring for a patient with a stage 3 pressure ulcer. Which intervention is the nurse's priority? Apply a transparent film dressing over the ulcer. Irrigate the wound with normal saline solution. Debride the necrotic tissue from the wound. Apply a hydrocolloid dressing to the ulcer. Pause the video and select your answer. If you chose option C, you are correct. Debride the necrotic tissue from the wound. Debridement of necrotic tissue is crucial for wound healing as it removes dead tissue and promotes granulation and epithelialization. This intervention helps prevent infection and facilitates the formation of healthy tissue. Click that subscribe button and join us next Friday.